The INSTI Multiplex HIV-1 and 2 syphilis antibody test is the world's fastest HIV and syphilis test, producing results in as little as 60 seconds. The test procedure is simple, and the test kit contains all the components required for testing. Package insert, membrane unit, lancet, pipette, alcohol swab, sample diluent, color developer, clarifying solution. All 3 INSTI reagent solutions are color-coded and numbered for easy identification. The test must be stored at 15 to 30 degrees Celsius or 59 to 86 degrees Fahrenheit. Before using the test, read package insert to familiarize yourself with INSTI and become familiar with universal precautions. INSTI is intended to be used in a step-by-step manner with no pauses or breaks during the testing process. Whole blood specimens collected by fingerstick should be tested immediately. Open the INSTI package and remove all contents from the pouch. Tear open the membrane unit pouch at the pre-cut edge and carefully remove the membrane unit without touching the center well. Place the membrane unit on a level surface. Make sure the tab of the membrane unit is oriented towards you. For sample identification purposes, the tab of the membrane unit may be labeled with the patient's name or identifier. Use of the workstation is optional. If the workstation is not used, place the test unit on a flat surface. INSTI can be used with fingerstick blood, venous whole blood, serum specimens, and plasma specimens. Prior to collection, warm the hand by washing in warm water. Ensure hand is fully dry. Lower the hand below heart level before collecting a drop of blood. Massage the finger with a downward motion several times before performing the fingerstick. Before using the lancet, look for a spot on the fingertip that is smooth, not calloused, and away from the fingernail. Fingerstick blood collection. Collect fingerstick sample using the capillary pipette. First open bottle number 1, the sample diluent, and retain the cap. Position the patient's hand in a way that is comfortable for the patient and allows you to easily press his or her finger to collect blood. The hand should be positioned at waist level or lower. Wipe the fingertip with an alcohol swab. Allow finger to dry thoroughly. Massage the patient's finger in one motion towards the tip to allow the blood to move to the surface. The fingertip will become slightly pink. As soon as the finger is dry, twist and remove the protective tab from the lancet. The appropriate areas to prick the fingers are indicated. Position the lancet just off the center of the finger pad. Holding the lancet by the body, press firmly to fire. Release the patient's finger and immediately dispose the used lancet into a proper sharps container. Do not squeeze blood from the finger until you have the pipette ready in hand for collection. Lightly squeeze the finger in one motion towards the tip to release a bead of blood. Filling of the capillary pipette is automatic. Do not squeeze the bulb while sampling. Maintain this position until the flow of the sample has reached the fill line and stopped. With INSTI, the first drop of blood does not need to be wiped. Hold the pipette horizontally and carefully touch the tip of the pipette to the large round bead of blood. Hold horizontally and gently, being mindful not to cover the pin-sized hole on the 50 microliters fill line. Add the 50 microliters of blood from the pipette to bottle number 1, the sample diluent, by squeezing the pipette bulb. The pipette stem has a pin-sized hole located at the black line. Squeezing the pipette bulb usually expels the blood from the pipette stem. However, if squeezing the bulb does not expel the blood sample into bottle number 1, cover the pinhole with gloved fingers and squeeze the bulb again. This should release the sample from the pipette stem. Step number 1. Sample diluent. Once the sample has been transferred into bottle number 1, the sample diluent, recap the bottle and mix well by inversion. Open the sample diluent and pour the entire contents into the center of the membrane unit well. The sample should be absorbed quickly. Wait for all the liquid from bottle number 1 to be absorbed completely. Step number 2. color developer. Resuspend the color developer by slowly inverting. Mix the solution thoroughly until the reagent is evenly suspended. Pour the entire contents of bottle number 2 into the center of the membrane unit well. The solution should be absorbed quickly. Wait for the solution to be absorbed completely. Step number 3. Clarifying solution. Open bottle number 3, the clarifying solution, and pour the entire contents into the center of the membrane unit well. The solution should be absorbed completely. The clarifying solution will reduce the background to provide more contrast to the spots and facilitate reading. Immediately read the result while the membrane is still wet. Do not read the results if more than 5 minutes have elapsed following the addition of clarifying solution. When reading the results, make sure the tab of the membrane unit is oriented towards you. Non-reactive result. One blue control spot that is clearly discernible above any background tint should appear on the membrane. The control spot indicates the test has been performed correctly and a human specimen has been used. Reactive result. 2 or 3 blue dots, including a control spot, that are discernible above any background tint indicate that the specimen contains HIV-1 and/or HIV-2 and/or syphilis antibodies, depending on the position of the dots. Following a reactive test result, HIV and/or syphilis confirmation testing should be conducted. Indeterminate result. One control spot and a faint background ring appears in the test area. Following an indeterminate test result, HIV and/or syphilis confirmation testing should be conducted. Invalid result. The test is invalid if there is no control spot on the membrane. An invalid test result means that the test was run incorrectly or insufficient specimen was added. Invalid test results cannot be interpreted. Any invalid test should be repeated with a fresh specimen using a new membrane kit components, and support materials. The rapid INSTI multiplex test is intended for use by personnel in medical facilities, clinical laboratories, emergency care situations, physicians' offices, voluntary counseling and testing (VCT) programs, and other establishments providing healthcare. For more information, please visit us at www.biolytical.com.